Thank you, Professor Sela, for this beautiful text. And as I know that you speak very well French, profession de foi. I open the discussion. If someone has a question or a comment to Professor Sela. Yes, of course.
I appreciated your talk, but I have one critical question. You say that you recommend to try to apply known drugs for new uses. What are the rules to have the permission to do that? Because I do know that human beings are not a priori elements to try out effects of drugs.
No, you don't have to try it immediately on humans. Just try it on animals and studies. But the idea is, as a matter of fact, I was not original because a short time later, the director of National Institute of Health devoted the whole institute or so on just on this, to try. You don't try it immediately, but you usually one forgets about the existence of such drug candidates when they were tested for something and they were not good. But they exist and one could test. Of course you don't do it directly on humans.
Again, on the subject of, well, really of your point that it's becoming harder to find new drugs, and you offered a couple of strategies. I recently talked to someone who told me the problem isn't so much that it's hard to find new drugs. The problem is that the drugs that we need, for example, new antibiotics that are not resistant, or to which bacteria are not resistant, don't make enough money for the drug companies, and so they spend their efforts developing drugs that are going to be used by people every day. Do you think that that's a valid criticism?
I think it's a fantastic problem, because even in my work, after we had this fantastic success with a drug against multiple sclerosis, a short while later, we produced a similar effective drug against a disease called myasthenia gravis. And the marketing people have refused that the company should continue to develop it, thinking there are too few diseases and too few sick people. And of course this is totally wrong, because in Japan and China there are more myasthenia gravis patients than multiple sclerosis. Anyhow, then everybody agreed that this is stupid, but nothing has happened. There are many, many such cases. And it's very embarrassing to appear before patients, because I cannot tell them, no, we don't have, they listen that we are producing something, and you can't come and say the real reason that it was simply for financial results. I'm sure that many cases are of this kind.
I think there are different kinds of problems when the drug industry is confronted with the possibility of making new medicine. But the main one that we are confronted at the moment has to do with the complexity of the diseases that we are trying to cure or prevent. We know not enough about the chronic degenerative diseases to be able to know which might be the targets for drug discovery. The recent failure of this Alzheimer's drug in the Lilly reported a week ago, based on the main hypothesis of how Alzheimer's could be modified, and it failed completely, shows that we don't know enough about the pathophysiology and the mechanisms of disease to be able to target small molecules or even proteins for the treatment of this condition. So we need to do a lot of much more basic research to understand what we are trying to cure or prevent.
You are totally correct, but I would like to tell you also how it started in my case. I didn't want to heal anybody. I thought that I have a way in which I could make experimental animals sick with a disease resembling multiple sclerosis. We prepared, by using polymers of amino acid, we prepared 4 different kinds of copolymers which resemble a little bit the basic polymer in the brain. And in the end, we injected the animals, and none of them wanted to get sick. It took us a year until we realized that what we prepared was the drug. And the name Copaxone means that there was copolymer 1, which we called COP1. And because the disease is both immunological and neurological, somebody in industry added the letters AX, like axon, Copaxone. This is the original copolymer 1. That's how it goes. That's the fun in science, that not everything appears the way you predict.
That's right.
Oh, good. Just a brief comment.
No, try again.
I think it's there, Professor Sela. It's on. It's on now, yes. Just a brief comment as another example, a point to Bill Phillips about the pharmaceutical industry. In my field of transplantation, it's departed completely. And because the market is not expanding greatly, the cost for anything further of initiation or introduction or research doesn't be borne out by what they feel they can realize ultimately. And then the generics that have come along and taken over a larger percentage of the market all impact on industry coming to bear on a particular clinical entity.
Yes, thank you for wonderful talk. As you said, there is this distinction that one can make between discovery and invention. But sometimes the line is thin, or very often one can argue it's a combination of both. We had CRISPR this morning with Nico's presentation, and it was clear that there was combination of discovery and invention and manipulation in making the technique. One could say it's just a debate about epistemology, but how does it translate in features such as patents or intellectual property or whatever? You did not mention anything about the patent problem.
Patents are very important. I'm not a specialist in patents, but it's clear that you have to patent in order to interest somebody, some industry in doing things. And there are various rules which change, and you have to do to protect this patent. I must say, in one of the meetings here, I had to explain that even if you want that all the money for, let's say, infectious diseases in the third world, you don't want to make money on it. But let's say that all the money you want to make, you want again to invest in continuing the study. But if you want patent, there will be no pharmaceutical industry that will develop it. So I can't give you any special details of the patent. Usually when we work, never mind on what the moment a paper is ready for publication, I had this one case when I had a study and suddenly I learned that a protege of mine who was a co-author has patented the the paper with completely different authors as a patent. And we had regretted, I mean, not I, the Weizmann Institute, to go to the federal courts in Manhattan. And then it was very interesting because our lawyer showed us the patent and our paper were superimposable. It was all copies of the same thing. So they were removed and I got this patent with my colleagues. But, you know, when it ended, it was very happy. But when I went there, and everybody was frozen because I said, this man is a very good scientist. I have a good opinion of his science. I have a problem with his ethics. That my lawyer already was frowning that I'm saying on a compliment, but this is what happened. And as a result of this patent, that there are 3 drugs against cancer. The latest, a few months ago, is lung cancer, which a company, in this case Eli Lilly, produced, and they had to come to Weizmann to sign a royalty contract because it was based on this. So that's the part. Remember, I've been working for 66 years, and these are things of the last 20 years that I learned this. That's why I'm saying I'm now aware on my own skin of these things, but this was not mostly the things of which I'm most proud.
Thank you. There are problems also about the patents, about the CRISPR system, I heard. Very difficult. Yes, sir?
The patents, in terms of the definition, what they try to do is to protect invention more than discovery, according to the definition of Professor Sela. But the problem now is that because the amount of communication has increased so much in the world, and there are so many groups working in the same area, the patents are in certain moments becoming not a protection for the inventor, but are trying to exclude everybody else from the field, which is hampering the development of research. So it is a contradictory situation in which something that was designed to protect the inventor is now creating very often problems for the development of science.
I will tell you, I had, without willing, to learn something about the development, but until now I refuse to get involved in patents. There are some lawyers, something, but everything takes time, and time is the most precious thing.
That's right.
Especially at a certain age.
Just an additional comment on the question of patents protecting inventions as opposed to discoveries. In the United States, there was a big issue about people patenting the discovery of human genes. And it always seemed to me to be unreasonable that one could discover a gene in the human genome and then patent it for the further development of possible. And if I'm remembering correctly, eventually the courts decided that you could not patent a gene that existed because, after all, it was made by God. They may not have used that language, but it's certainly the way I felt about it. And I wonder, this whole issue about what can be patented, what can't be, the way in which patents protect things, and sometimes the way in which patents impede the development, might be an interesting topic for a future discussion in this body.
About it. Other questions to Professor Sela? If not, we are going to